Hi, I'm Dr. Ken Iserson, and I'm your host for a series of 3 videos. When and why do we need to ration healthcare resources? And what is the ethical justification? How do we plan for and initiate healthcare resource rationing? And finally, who allocates the scarce resources? Describing how to identify, train, and use crisis triage officers to ration resources at the patient care level. That video also discusses how risk communication techniques can make the entire system run more smoothly in crises. Key points for this video are: who allocates healthcare resources during crises? How are crisis triage officers selected and trained? How should crisis triage officers function? And how do risk communication techniques, when employed through multiple communications media, maintain healthcare workers and the public's trust in crisis triage officer decisions? The first question is, who allocates healthcare resources during crises? Rationing scarce healthcare resources is not easy, especially when decisions must be made about individual patients. It's not enough to have a plan for allocating scarce healthcare resources. There must be previously identified individuals who are prepared to make these difficult decisions. The job requires the presence of clinicians who have the best available clinical knowledge, know what resources are on hand, and have been trained to allocate resources equitably. They must also have the authority to act and the full backing of the administrative and the clinical staff. The person responsible for performing this tremendously difficult task is called the crisis triage officer. This individual acts as the moral agent to ration available healthcare resources under an established plan. In the emergency medical system or pre-hospital setting, this crisis triage officer is usually the on-scene or incident commander. At the regional and national levels, where more general rationing decisions are made, is the incident commander or designate. In a hospital, the job of crisis triage officer should rotate among a trained and experienced group of people. In this setting, it is usually not the incident commander who has too many other responsibilities. Our second question is, how are crisis triage officers selected and trained? Away from hospitals, individuals in specific positions, whether or not they have the expertise, must often act as crisis triage officers by default. Within a hospital, crisis triage officers should be selected from respected members of the medical staff who have the medical knowledge and people skills to effectively and efficiently ration healthcare resources. To be effective, the pool of crisis triage officers must be designated in advance. This permits them to have adequate education and gain experience in their role. They become familiar with the disaster plan by practicing their role when resources are scarce but not critical, and during disaster drills. Over time, they learn to adjust their methods to deal with the real problems they encounter. Frequent interactions with their institution's bioethics committee helps crisis triage officers understand the ethical implications of their role and how to deal with allocation dilemmas. Our third question is, how should crisis triage officers function? Crisis triage officers allocate critical healthcare resources using the criteria of best outcome. That is, the amount of resources times the length of time they are needed. Decisions should be consistent with the best available clinical information and made in concert with the treating team and expert consultants. The final decision is never made by the patient's primary physician. The crisis triage officer is the most difficult position in any disaster response system. They must decide, based on available resources, which patients go to the expectant, dying category, when not to transfer patients, or even when to abandon patients if facilities need to be evacuated. To be effective, the crisis triage officer's decisions must be final. The healthcare staff and administrators must understand the crisis triage officer's role and be prepared to fully support their decisions, no matter how painful. During a crisis, each crisis triage officer should work for only 4 to 6 hours, followed by an 8 to 12-hour rest period without other duties. However, there must be excellent communication among group members, such as passing on a logbook at shift changes that contain vital details about situations encountered and decisions made. Crisis triage officers must operate under general utilitarian guidelines rather than rigid rules. Crises, by definition, are fluid situations requiring rapid, complex decisions. To be effective, crisis triage officers need maximum flexibility when making such complicated and painful decisions.